I'm going to talk a little bit about the neck, or the cervicals as they're called. There are 7 cervical vertebrae here, C1 through C7, obviously between the cranium and the thoracic cavity. And even just looking at the neck here, we can actually see that how vulnerable the cervicals are as opposed to the thoracic vertebrae, which has ribs in the whole cage that keep it stable. So you can see that there's nothing here stabilizing the neck, so it can be quite a vulnerable area. There are so many different things that can actually influence the neck having trouble and creating pain in the neck. Of course, you can have a car accident with a whiplash that will actually whiplash the muscles themselves, but say you don't have a car accident and you have neck pain. One of the things that can happen is you can have some kind of dysfunction in the thoracic cavity, something going on with any of the organs in here, and they can tighten down and pull into your neck. They literally begin to pull your cervicals forward, and what happens is when the cervicals are being pulled forward, the muscles have to work hard to hold this 12 to 13, 15 pound head up. That is where we begin to get some of the pain, is when muscles are doing a job that they're not supposed to do. A muscle's only job is movement. If they're doing something about stabilizing or holding something up, they can go into pain patterns. What else can be something that can give you neck pain? Strangely enough, is my jaw complex is very related to the back of my head and my upper cervicals. Very, very related. My maxilla, my mandible, is very related to my occiput and my first and second cervical. If I have some dysfunction, there can be many different kinds of dysfunction happening here in the jaw complex that can go back into these upper cervicals and create a lot of upper cervical dysfunction and pain eventually. So those are just a couple of ideas of what can happen that can really create dysfunction in the neck.